This is Dr. Garrett Harper. I want to talk to you about your postoperative breast augmentation recovery. So a little of it will depend upon where the breast implant was placed, whether it was placed above or below your muscle. Certainly if the implant was placed above your muscle, it's a little easier recovery, but only in the magnitude of several weeks. There are pros and cons to each approach, and some patients aren't candidates for either approach, so it really depends upon what your surgeon has chosen for you. Briefly, for the first 2 weeks after any surgery, we're going to want you to take it really easy. Do nothing that causes you to sweat, no physical activity that gets your heart rate or your blood pressure up too much, and mainly that's just to decrease the amount of bruising or bleeding that you would have. Drains are very seldomly used for this surgery, but if they are, we will teach you drain care and remove those drains when they're ready to be removed. That's pretty much the short answer for it. We'll have you log whatever drain output you have, and then according to the nature of the drain output and the amount, we'll remove those here in clinic. It's probably best that you put yourself into a comfortable position. One thing that we don't want you to do is to round out your shoulders, because ultimately you'll start having neck and back strain. So it's okay to sit up with good posture and get your shoulders back. We don't want you using your arms wildly, so no third base coaching. But basically you can do all of the activities that you're used to at home, just making sure that you're listening to your body and not going overboard on anything. At around 1 week, we'll see you post-op and make sure that everything looks great, that there's appropriate swelling and bruising. Remember, after a breast augmentation surgery or even a revision breast augmentation, it's going to take several weeks to months for the final product to kind of show itself. So don't be worried if things look like they're too high or they look too fake. The decisions that were made pre-operative will be the ones that bear the most fruit at the end. So give it time. Trust the process is something we say in plastic surgery. And of course, if you see any bruising or swelling that's asymmetric or is a lot different than when you left our post-op recovery center, contact us immediately and we'll get back to you. Thanks.